So my take, and I would love Dr. Robin for you to jump in if you want to, but I have been getting a lot more questions about the Delta variant and what's going on, and are we headed that direction? And um, my take on it has always been we always have to kind of think in two lanes, probably at least two lanes, but two lanes are personal health, what's affected, and then think in terms of like the community, right? And so if we look back to the very beginning, there were so many unknowns. One, we didn't even know what our personal risk was because we really didn't know how the virus behaved in different populations. And then, from a community risk, we didn't know how much was around at the very beginning. We didn't have a lot of testing and we didn't know how it was behaving. So, that's when community measures were like felt very broad and very sweeping and that was, appropriate for a time where hospitals were filling up and didn't have enough protective equipment and were at risk of not being able to serve people with COVID and people having babies and strokes and car accidents and all that stuff. And then as things have evolved, that now we know more about how the virus behaves, even in its little variations, and all the variants, I think, are very expected. We just know that that's how viruses work. They mutate very quickly. And so we know a lot more about how the virus works. We have the opportunity for vaccination for everyone, 12 and above. And we have, testing. So now I don't think we'll ever go back to like those sweeping mandates, hopefully, unless my own thought is always, unless the healthcare system is jeopardized again, unless there's no more rooms at the end, then it's like a community health measure. But, hopefully that won't be the case now that enough people have had the opportunity to become vaccinated. Now, so a lot of people also ask me about, what about the kiddos? They haven't had the opportunity to become vaccinated, and that's, so true. And I never want it to sound like, well, the kids can get sick, you know, just who cares about the kids? We want to keep our kids safe, obviously, but the reality of the way this virus behaves, and what we're seeing now, even in the Delta variant, is the young kids aren't having the same amount of risk as what we've been hearing about this whole time. The number of kids that have to be hospitalized or really have a tough time with it seem to be, very low. So not that you can compare, like, it's not exactly apples to apples, but I kind of think about those seasons, and Dr. Robin, you probably remember like the really bad flu seasons or the really bad RSV seasons. Like those were seasons where, physicians were like, oh my goodness, like there's so many kids in the hospital and there's so many kids that are on ventilators and needing oxygen. And those seasons were a lot worse for that population, but there were no community health measures taken. Whether that was right or wrong, like, I don't know. But do you have any thoughts on that, Dr. Robin? Not to put you on the spot.
Well, I was just thinking that you probably got this too, Paige. There was a health alert that came out from, oh gosh, I forget which organization, just last week about RSV being on the rise, for little kids and older people. So it does make everything really confusing when you have people that don't have their COVID vaccine, and now here's another wave of a different virus coming along that could jeopardize those fragile populations. So I think knowing something like that, like there's another wave of this other virus coming, really speaks to the fact that people who are not vaccinated for COVID should really probably do that.
Yeah, I think so too. I think, because the reality is, if I didn't mention it before, the reality is still very true that of all the increases in cases that we're seeing, especially the, what we really track a lot of, which cases that end up with hospital visits and long hospital stays and ICU ventilator type stuff, long-term stuff. Those cases are almost exclusively non-vaccinated people. I think the last numbers I saw were in definitely the upper 90s. At one point it was 99 point something. So, we're in a situation where it's like, what do we do as a community to protect the non-vaccinated at this point? And when you get into some difficult conundrums, because some of those non-vaccinated people are like, they had the opportunity to become vaccinated, like, so it's a hard call. And I think we'll just, we'll have to kind of look at the numbers when it comes to, as a community, what we need to do to like get numbers down. But at a personal level, it still remains like the strong message is that, if you have the opportunity to become vaccinated, which I personally have not encountered anyone when we weigh the risks and the benefits of vaccination versus not vaccination, that vaccination doesn't win hands down, not to say that vaccines never have side effects. This one in particular, you may be tired, you may run a low-grade fever, like it is a workout for your immune system. But I would much rather have my immune system like lift the weights now to then be stronger when I get it, than I would just to, expect my body to run the marathon when it comes along without training for it.
I heard a ICU doctor on the radio a week or so ago saying that this is just so heartbreaking to me. It's so sad. But she was saying that literally with this new surge, as people are about to be intubated and put on the ventilator, they are saying, I'm so sorry I didn't get the vaccine. I should have gotten it. Can you give it to me now? And that's really heartbreaking. And it makes me realize that I guess there are a lot of people in the general population that don't understand the way vaccines work. I mean, you can't get it at the last minute like that. But she said that she's had so many patients say that.
Yeah. And it's hard. Like I get when people are nervous to get a vaccine, especially when you hear things like, oh, it's so new. When the reality is, it's new to market, but the technology is not new whatsoever. But it's a different mindset when you proactively do something versus taking your risk of like, maybe I'll get away with not getting it. But the reality is like, you just don't want to take that risk because most people agree that coronavirus will be endemic. Like it will make its rounds, just like a lot of other viruses over the years. So my hope is that we're not going back to anywhere near, what we've been through. But at the same time, it's something that we still have to navigate our own health first and foremost. Like, are we taking care of our immune systems? Are we sleeping well? Are we staying well hydrated? Are we having our nutrition? That's upkeeping our immune system. Are we working out? Are we not stressing about it? That's probably the biggest thing that suppresses the immune system, which we've all encountered those times where it's no coincidence when you have been up all night studying for a test a few days in a row, then you come down with a cold, or, when you're under intense stress, that cold sore pops out or whatever, get shingles. And so it's, that's one of the other things when you talk about, people that are walking around fearful and watching the news and, just worrying about it all day long. It's like we're shooting ourselves in the foot at that point. There's no use in acting out of fear for anything. So I don't think luckily we'll go back to exactly what it looked like, but the preventive measures will not go away, unfortunately. Not for a little while, not till this surge. And then hopefully, you hear people talk about like the concept of herd immunity. So we're not at herd immunity yet. So thus we have these spikes, but the goal is to get to a point where as if enough people are vaccinated, then the virus just doesn't have the ability to popcorn and spread like it like it has in the past. And especially with this Delta variant seems to be a little more easily spread than the previous. So COVID update 101. Won't it be nice when we don't have to give those up? Worry about those updates.